Hi, my name is Phillipa. I'm the acute team lead for the Dietitians at Dartford Valley Hospital. June the 12th to the 16th is Dietitians Week this year, so we're aiming to promote the awareness of the role of dietitians, what we do, who we see and how we can help our patients. For Dietitians Week, we will all be putting ourselves in our patients' shoes by trying some of the special diets that we advise them to follow. In this video, we'll be telling you about our different roles here at Dartford Valley.
My name is Amelia. I'm a renal dietitian working at Dartford Valley Hospital. I work with patients with both acute kidney injury and chronic kidney disease, including those that have dialysis. I'll provide advice on healthy eating and meeting their nutritional requirements safely. Dietary advice can be complicated and would depend on the stage of kidney disease, any other health concerns and the individual needs of a patient. When the kidneys aren't functioning properly, some minerals can build up to dangerous levels. When this happens, it might be necessary to reduce the intake of foods that are high in these. In particular, we look at potassium and phosphate. I base advice on patients' blood results, what they're eating, to provide individual advice. Every patient is different, and the advice is tailored specifically to you. What works for one may be very different to what works for another. It's important for patients to spend time with a specialist dietitian rather than following advice from a neighbour or Google.
My name is Yvonne. I'm a gastroenterology specialist dietitian. I look after patients who have an illness in the gastrointestinal tract or the GI tract. For example, patients with Crohn's disease, ulcerative colitis, pancreatitis, liver disease, gallstones, irritable bowel syndrome and celiac disease, just to name a few. I also look after patients requiring surgery in the GI tract. The GI tract plays an important role in food digestion and metabolism. If there is an illness in the GI tract, it could affect one's ability to digest and absorb food, impacting their nutritional status. For Dietitians Week, I will attempt to not eat and drink for a few days. To stay alive and hydrated, I will have a nasal gastric tube, which is a fine tube that goes through my nose and my food pipe and down into my stomach. I will then be syringing liquid food and water through the tube. Nasal gastric tube feeding is usually required for patients with severe swallow difficulties and those who are in a medically induced coma. If patients can't swallow safely, food and drinks can potentially go down the wrong way, causing serious chest infections.
My name's Jess. I'm a specialist gastroenterology dietitian with an interest in respiratory medicine. Other than the patients I see with gastrointestinal disorders, I also see patients with COPD, TB and obstructive sleep apneas. This patient group is very varied and they may need different advice depending on their condition. This variation in my role keeps it very interesting as I get to work with different teams and different patients. But for Dietitians Week, I'm focusing on the gastroenterology side of my role and I am following a gluten-free diet. The gluten-free diet is the only treatment for people diagnosed with celiac disease. Celiac disease is an autoimmune condition caused by a reaction to gluten, which is a protein found in wheat, rye and barley. When someone with celiac disease ingests gluten, their system reacts by damaging the lining of the small intestine. This often leads to the malabsorption of elements such as iron, vitamin B12 and folate, and other symptoms can include wind, bloating, vomiting and diarrhoea. I'm following this diet for Dietitians Week to further develop my understanding of what it is like to live with celiac disease on a day-to-day basis, experience that change of lifestyle, but also to improve the care that I provide to my patients. If you would like more information on celiac disease and the gluten-free diet, search for Celiac UK.
My name is Geoff. I'm the Oncology Dietitian at Dartford Valley Hospital. I provide the dietetic service to Rosewood Ward and the chemotherapy day unit, primarily focusing on nutrition support. I look after patients with a range of cancers including esophageal, lung, stomach, pancreatic and bowel cancers. For many with a cancer diagnosis, eating and drinking can become very difficult for a number of reasons, resulting in weight loss and nutritional deficiencies. This can be due to the nature of the disease itself and the associated side effects from anti-cancer treatments such as chemotherapy, radiotherapy and surgeries. These side effects can include a poor appetite, taste changes, swallowing difficulties, sore or dry mouths, nausea and vomiting, constipation and diarrhoea. Therefore, many of my patients require dietary advice and support through food fortification and oral nutritional supplements to maintain their weight and nutritional status. For examples, those with an esophageal cancer or cancer of the food pipe, the narrowing of the esophagus caused by the tumour can make eating solid foods difficult, with many patients resorting to following a liquid diet. For Dietitians Week, I'll be following such a diet, primarily having ensures and foods such as soups, with the aim of maintaining my weight and overall nutritional status.
I cover the intensive care unit at Dartford Valley as part of my clinical caseload. I also do a weekly ward round as part of a multidisciplinary team, and I review patients in the hospital who are on parenteral nutrition. Parenteral nutrition, or PN, is a nutrition that is given intravenously through a vein, so the whole digestive tract is bypassed. I'll work out the patient's requirements, consider factors such as medications, blood tests, bowel function, and any gut-related symptoms before designing a feeding plan for the PN. We usually give PN when patients can't have food and drink orally or through a feeding tube into the gut. This may be because the gut is slow to get working again after an operation, or because extra time needs to be given to let it rest and heal safely. Some patients may require PN long-term if they do not have enough functioning gut to absorb food and fluids adequately. But for the vast majority of patients, PN is just a temporary treatment until the gut recovers enough and normal eating and drinking can resume.
Hello, my name is Tracey, Elks, and I'm a paediatric dietitian. As part of my role, I see children from birth to 16 years old and up to 19 years old if they have special needs. We see children in the hospital, run outpatient clinics, do group education sessions for parents and healthcare staff, and sometimes see children at home or in their own schools. We might give advice to babies who are struggling with feeding, children with allergies, selective eaters, or assess the nutritional adequacy of all sorts of different children's diets. We have specialist clinics for gut issues, diabetes, premature babies, and as part of these clinics we work as a multidisciplinary team. We also look after children who are fed through a tube. It's a really varied job and there's never a boring day.